Hello, my name is Dr. Julian Barwell and I'm a consultant in clinical genetics at the Leicester Royal Infirmary. This podcast is about non-alcoholic fatty liver disease and its resulting susceptibility to hepatitis, cirrhosis and hepatocellular carcinoma. In the clinical genetics department, we are referred a large number of families where a disease has occurred in a greater number of relatives than you would expect by chance alone. There are a number of different conditions that can affect the liver that can appear to run in families. Hepatitis viruses and alcoholic liver disease are common causes of liver problems, but are not due to an inherited alteration in the genetic code, which is called DNA. Wilson's disease, hemochromatosis and alpha-1 antitrypsin deficiency are rare inherited conditions that often affect brothers and sisters but not their parents or children. They are inherited in autosomal recessive fashion, whereby affected relatives have inherited an altered copy of a particular gene from both parents. However, there is a type of fatty liver disease that tends to affect multiple generations, and this is called non-alcoholic fatty liver disease. This condition is more commonly associated with diabetes, a raised body mass index, high LDL cholesterol, and high blood pressure, as part of a newly named condition, the metabolic syndrome. However, there are also affected families where the metabolic syndrome is not a major feature. Having a high proportion of fat in the liver is becoming increasingly common in the Western world, due to a change in our diets over the last few decades. Fat generally becomes visible on ultrasound when 20% of the weight of the liver is thought to be due to fat. It's often found in individuals having a liver ultrasound for another reason, and usually does not greatly affect how the liver works. Approximately a third of individuals with a fatty liver go on to develop inflammation called hepatitis. This can reduce how effective the liver is at carrying out its everyday functions, such as storing iron, removing toxins in our blood, and controlling sugar levels during sleep and exercise. Hepatitis can result in tiredness, a yellowish tinge to the skin and the white of the eye, as well as abnormal liver function tests. If fatty liver disease and hepatitis is untreated, a proportion of individuals may develop permanent damage, scarring and fibrosis of the liver. This is generally irreversible and is likely to be detrimental to long-term health. Approximately a third of individuals with cirrhosis go on to develop hepatocellular carcinoma. If it is detected early, sometimes it can be treated with surgery, chemotherapy or a transplant. In families affected with non-alcoholic fatty liver disease, where the metabolic syndrome is not commonly seen, the main cause of fatty liver is not usually high cholesterol. However, it is likely that diet has a strong effect on the age of onset of the condition, and it is sometimes seen in younger generations who have emigrated into Western countries. The best way to treat families with non-alcoholic fatty liver disease is to consider a 5-point plan. Firstly, to undergo regular liver scans, including ultrasounds and fibroscans in adults, to accurately assess the amount of fat in the liver. Occasionally, a biopsy may be necessary to look for evidence of permanent scarring and damage. Secondly, to abstain from alcohol. Thirdly, to have a diet low in cholesterol. Cholesterol is commonly found in chips, cake, cheese, crisps and cream, which we call the 5 C's of cholesterol. It is worthwhile reading food labels and speaking to a professional dietitian if you have any queries about this. Fourthly, to seek the advice of a hepatologist and your regional clinical geneticist to determine if there is likely to be an underlying genetic inherited component to your condition, and whether genetic tests are likely to be of benefit in understanding the cause of the condition. At present, we know that a very common subtle change in the PNPLA3 gene, which is important in the way in which the liver stores part of the fat called triglycerides, is associated with a high risk of this condition. However, it is unlikely to be the only factor involved, and research is currently being carried out to identify other genetic factors involved. Finally, speak to your hepatologist about any medication that may help treat this condition. A number of agents have been tried in the past, including high-dose vitamin E, anti-diabetic medication, statins and losartan, which is a drug used to treat high blood pressure. A few of these drugs improve the blood results in patients, but in the small studies, losartan is the most promising to date in actually altering the course of the disease and reversing early liver damage. It is important to note that all of these drugs, including high-dose vitamin E, have side effects, and the decision to take these drugs should only be taken by an expert in the field, particularly if the patient is otherwise well, without high blood pressure, cholesterol or diabetes. It is important to stress that the majority of patients with fatty livers do not develop major liver problems, and it is reversible usually with dietary and lifestyle advice, and occasionally with the use of cholesterol-lowering medication. To support families with a susceptibility to fatty liver disease and cancer, we have developed the Supporting Families with Cancer partnership between Macmillan Cancer Support, the Leicestershire Clinical Genetics Service and Genie, the University of Leicester's Genetics Education Centre. As part of this partnership, patients have the opportunity to attend a weekend or evening event to meet geneticists, dietitians, physiotherapists, local and national support groups, counsellors, smoking cessation, cancer prevention and research teams. Anybody wishing to attend an information event or find out more about familial susceptibility to non-alcoholic fatty liver disease can contact us at sfwc@le.ac.uk. That's Supporting Families with Cancer at le.ac.uk. Thank you for listening and goodbye.